What I'm going to try to do is give you, in 1 hour, which is almost impossible, a picture of what is wrong in the brain of a person after they develop the disease of addiction. So we have here what is supposed to be a normal brain. Don't worry, I'll explain it all. And then I'm going to paint little by little over there the picture of what are the changes that happen when a person develops addiction. Then we can maybe make some kind of conclusions or interpretations or change dramatically the way you see addiction. I have to get started by telling you, we thought this is the normal brain and this is the brain of an addict. It's normal. There's nothing wrong that we can identify, so it's all psychological, weakness, selfishness, narcissistic, stupidity. That's the way we conceptualize the disease initially, but we can no longer say so because now we have neuroimaging who can tell us what is going wrong in the brain. Not only that, we're learning tremendously about the essence of being human through this disease, as well as another disease that some of you may be familiar, schizophrenia, which are my main interests. I am a psychiatrist, a psychopharmacologist, and an addictionologist. And probably my interest has been to put together all my training into addiction, to maybe paint a more truthful view of the disease. And honestly, the more I get into this, the more disturbed I feel by the way we're treating people with addiction. So everything started with addiction with the normal brain. But in order to understand the normal brain, we have to clarify some issues. Issues that we discover accidentally, precisely through addiction. First of all, you see that tiny little thing right here? Okay, this is half of my brain. I'm looking in that direction. So imagine that I remove this half and you're looking at that area. My eye is around here. My mouth, my face, the back of my head. And this is looking inside my brain. We noticed that the reason we thought addiction was a selfish, narcissistic desire to get high, voluntarily done, is because obviously that's what we see. They get high, they like to get high, they don't care about nothing else, and all they want to do is to be high. You tell them stop, but they don't stop. We thought they want to continue getting high. And we know why, and that is known from the beginning. That is because of that tiny area that you see right here, which is no bigger than this side. It's a tiny area. It's in both hemispheres, so I have two of them. And it's called the nucleus accumbens. Why do we have that in the brain that makes us feel so good? Why we have it? Worms has it. Butterflies has it. All animals has nucleus accumbens. So the first question is, let's destroy that thing in animals and see what happens. The animal will stand in the corner. They will not eat, groom, sleep, eat, or do absolutely nothing. They die. So we realize that that tiny area seems to be connected to another area of the brain that motivate and make us feel good when we do things that we should do. So the reason I drink water is not because I want to drink water. It's because my brain senses that I'm low in water, and it will tell my internal brain, make him crave water. And I will all of a sudden say, I'm thirsty. So I go and drink water. When I drink water, I release dopamine in that area of the brain, and I feel pleasure. So I'm reinforcing a behavior that can keep me hydrated or alive or healthy. Like that, we have identified multiple behavior that we do naturally. Sometimes we can interfere with it. Well, I breathe. I'm not telling myself, breathe, don't breathe, breathe, don't breathe. Something internal is doing it for me. I could stop my breathing, but it will not be for long. As soon as this part of the brain, the internal brain, realizes that I'm holding my breath, it will force me to breathe. So I have some control, no total control over it. So whenever you do something positive, something right, this area of the brain, ventral tegmental area, they have weird names and there's nothing I can do about that. The ventral tegmental area is connected with the whole brain. And when you do something right, it releases dopamine. a neurotransmitter that is produced when we do good things as a reward. So when I drink water, something in my brain senses it, and this thing sends a signal to the nucleus accumbens, and it pours dopamine into it, and I feel pleasure, satiation, satisfaction. So we have a tiny area connected with the whole brain, which by releasing dopamine makes me feel pleasure. So the brain has this sacred system to motivate me to do things, and when I do them, I get rewarded. So the nucleus accumbens is the reward system. I give my kids $20 because he behaved. He gets the $20 and feel good. Now he's going to try to do whatever he was doing that I gave him the $20. That way I reinforce, reward, and his brain will teach him to be motivated to do it. If I reprimand my kids about something, he feels bad. So this area shut down dopamine, and the nucleus accumbens feel bad. So everything we do, good or bad, is done by this tiny area, receiving or not receiving dopamine from the brain entertainmental area. So look how strategically connected. It's a tiny area in an isolated location, but it is connected, wired through a circuitry to the whole brain. So the reward system is what the drugs stimulate. So you do drugs, it doesn't matter which one. All drug of abuse release dopamine in the brain. Of course, because dopamine is the language needed to stimulate the reward system. I joke around to make people understand. If the chemical in pineapple is what makes this thing feel good, pineapples will be the worst drug of abuse on earth. It will be banned, destroyed, and nobody can walk around with pineapples. Because dopamine happens to be the neurotransmitter, the brain decided to use anything that increases dopamine in the brain is going to stimulate the nucleus accumbens. By the way, he releases dopamine, dopamine goes here, and this tiny thing is connected with the whole brain. So you feel a unique sensation that seems to be pleasurable, that we call a high or satisfaction. You can call happiness sometimes. Now everything causes that. I can grow up in a culture that something will bring down my dopamine, while somebody else can grow up in a culture and that same thing can make them feel good. Let me give you a little nasty example. In Arab country, when you finish eating, you have to burp. That means the food was good. But in our society, you burp while you're eating, and they're going to say to you, "Ooh, what's wrong with you?" So look how one behavior can be taught to be good or bad, depending on culture. So, we don't have the same behavior associated with a good response. We learn it, depending on the culture, the city, the country, the continent, the hemisphere, etc., etc. So then we have this, hippocampus. And what is here? This is the memory center, where you assimilate everything that you learn in your culture that is good and is not good. So we behave socially because we learn from early on a set of behaviors that we should or should not do. Now you see inside those little lines that are going down, they are organized in a very specific way. The more dopamine you release, the more important it's going to be as a memory. The lower the dopamine, the less important it will be. So while addiction was thought to be just a stimulation in the nucleus accumbens to make you feel high, we realized that addiction has taken over something much more important. And it has to do with the memories. So in addiction, besides reward, we have memories, or what is called the motivational system. So, if the most pleasurable thing in the memory is here, and we happen to know what it is in human because we measure it, is the behavior that gives you the highest level of dopamine. It's called orgasm. You're going to get 200 units of dopamine when you do that. Why the brain is doing that? because when you have one, you reproduce. And that is the most important function in humans. We eat, we drink, we take care of ourselves, we behave so we can reproduce. So the highest prevalent in brain is coming from an orgasm. 200 units. So you're going to get 200 units when you have an orgasm. What you don't realize is that you're not doing it to have the fun. You're doing it so you can reproduce. So they come after, meaning you reproduce, we reward you, we give you pleasure. So if this is the highest amount of dopamine we can get from a behavior, you get 150 when you graduate, you get 175 when people reward you, you get 225 when you smoke a cigarette. But you don't get it in 15 seconds, you get it in much more time. So now you're doing something that is going to give you 4, 6, 8 times that amount of pleasure. Any substance of abuse. I'm not talking about addictive behavior, but they're exactly the same. I'm not talking about food addiction, gambling, kleptomania, hoarding, that kind of behaviors. Only substances, chemicals. So when your brain experiences pleasure from a drug, it is getting a huge amount of dopamine being released into the nucleus accumbens. It goes like this. The drugs go to the ventral tegmental area. It releases an unbelievable amount of dopamine, which makes the nucleus accumbens feel a tremendous amount of pleasure. This amount of pleasure, measure up to 1,000 units of dopamine, it is almost immediately put into the memory. But it's not going to be put down here. It's going to be put on this side. So now you're going to have a memory inside your brain, which is going to be huge for the use of drugs. And that will take priority over any of the previous memorized behaviors that you have in your brain. So drugs, by impacting over the brain, will modify the circuitry related to reward, memory, and motivation. And you're going to substitute any behavior that was pleasurable for the use of substances.
This is where part 2 starts.
So, it looks like the definition is changing now. It is a neurological disease. It is caused by an insult to the brain done by chemicals who are defined by the capacity to release dopamine. They make you feel pleasure, but you also memorizing them and giving them saliency or preference over any previous behavior that used to be satisfying for you. So now we have that the brain, after you expose yourself to drugs long enough, will change its priority toward the use of drugs, recovering from drugs, or pursuing the way to get the drugs at the expenses of your previous usual behavior. So if I develop an addiction to a particular drug, I'm going to eliminate little by little all my priorities from taking care of my kids, working, relating with my friends, being around people. And all I'm going to do is focus myself on using, abusing, and doing whatever I have to do to get drugs. But this is not a voluntary phenomenon coming from the prefrontal cortex. This is coming from deep within the brain in what we call, in general, the primitive brain. If my primitive brain wants me to be alive, it's going to make me do the things needed to be alive. The primitive brain is blind, doesn't smell, doesn't see, doesn't follow rules, doesn't care about consequences. If that primitive brain is told that his job is to make me do things so that I can release dopamine and feel pleasure, the primitive brain is going to be hijacked into believing that drugs is the most important thing to do for that human being. And he will use all his tricks to make me use drugs or increase the abuse of drugs when the tolerance develops. So after I use drugs for a couple of days, I start making some memories. They're not that strong, but they are going to go, here it is, to my frontal lobe. And they're going to tell me, go for a couple of beers. And I voluntarily will say, nah, I don't want to drink. There is no disease of addiction. But if I keep drinking, this signal is going to get signal from this other part of the brain, and this part of the brain, and this part of the brain. And now I'm not going to get a weak signal. I'm going to get a very powerful signal from my brain telling me to use drugs. The prefrontal cortex make a judgment, an action. This is what makes us human. Without prefrontal cortex, we probably will not have an addiction. But prefrontal cortex is what makes us human, intelligent, and what we are right now. So most of the time, these signals are not strong enough to make me substitute a social behavior for drugs. And you tell me, let's go and get drunk. And I say, no, I don't want to get drunk. So I probably have a use or abuse, but I don't have the addiction. So when these forces coming from within the brain bombard the prefrontal cortex to a point that the prefrontal cortex cannot say no, the patient automatically will go and use. If he was sober, he's going to relapse. So when these forces coming from deep within the brain and take over a weak prefrontal cortex, basically the person will automatically relapse. Do they know what's going on? No. What will they usually tell you? I don't know. I couldn't help it. And the point is that it's not a voluntary disease. It's involuntary. It is deep within the brain. And it has to do with the essence of being human. Let's destroy this thing in humans, and that's it. Well, we cannot destroy that little tiny area. If we do it, we will not be motivated to do nothing in life. We will sit in a chair and do nothing. The closest to that is Parkinson's disease. You heard about Parkinson's disease? Parkinson's disease is treated with dopamine drugs, but eventually the dopamine system dies. You sit there in a chair, they will stay 24 hours sitting there. They will not ask for anything. They will not do nothing. So we cannot touch that area of the brain, because by doing so, we basically will stop being human. So the reason we do certain things, I like to go this way. I don't like to go this way. I'm not making the decision. Memories from me going that way or this way are in my brain. And they will fight with each other. If he goes this way, I'm going to give him some dopamine. If he goes this way, I'm going to make him punish and lower the dopamine. So the brain basically tells me what way to go. So if you like something, it's because you associate that with pleasure. If you don't like something, it's because your brain didn't. So I'm going to resolve a big conflict in couples. That is a big problem. The husband wants the wife to do X, and the wife wants the husband to do Y. And they're in conflict. So I like to watch animal programs. My wife hates it. She likes to watch detective programs. Boring. Basically, my brain releases dopamine when I do what I do, but I don't release dopamine when I do what she does. And the opposite for her. So even that behavior is not basically my preference, is the way my brain ends up wiring and memorizing those events. So when a person develops changes in the brain circuitry in which drugs become the most important motivation for life, that person will have the disease of addiction. And because of that, his life is not going to be in control. Even if he says, I'm not going to do it, this is the boss. And this will make you do it. Now, when we look at a person who is abusing substances, all these changes will modify that brain because high level of dopamine, physiologically, the way the brain functions, is clearly telling the brain something is wrong. So the brain will decrease the potency of this circuitry and try to weaken the stimulation in the nucleus accumbens. And the brain uses different ways to do that. So if I get high and my dopamine goes to 400, and I do it again, and again, and again, eventually my brain is not going to give me 400 units of dopamine. It's going to lower the dopamine release. So I'm going to need more drug to keep the same level of pleasure. That's tolerance. Now the brain resets itself. So to be normal, you need 100 units of dopamine. If you do the right thing based on your culture, you'll be fine. But if you develop the disease of addiction, you reset your brain to 300, not 100 dopamine. When you stop doing drugs, it's going to go from 300 to 100, and you are not going to feel well. You're going to develop a negative emotional state. Your life will be miserable. You will not enjoy things the way people normally do. You will not be motivated to do much. Your brain now says, I want 300, not 100, because those are the changes needed so you don't die. As a consequence of that, what follows addiction is a state of low energy, low motivation, low desire to accomplish things in life, which we now call negative emotional state. You guys call that depression. And you want to get medication for that, thinking that an antidepressant can fix this mess created by drugs. And of course, interesting enough, it does the opposite. It messes up your brain. Addiction relapse, patients feel guilty, family pressure the patient doesn't know what's going on, the doctor is telling him, I'm doing my best. I don't know why you relapse after you were doing better. And patients go back to square zero. So basically, the treatment of persons with addiction require that we basically put him back in the normal environment that allow no drugs to be used. And our fantasy was that by doing that, this will rewire back to normal. It's not happening, and it looks like it will never. Once an addict, always an addict. It's true. It's proven. So the idea is that these changes are, so far, irreversible, permanent, and I'm going to simplify the way one of the experts in animal studies of addiction, I asked him, give me one phrase. What is addiction? He said, addiction is a neurological insult caused by drugs that the patient have to learn to live with. I says, okay, can we undo it? No. What's the best way to focus into the addiction? Prevention. We need to educate that if you go that route and you don't stop it when it is stoppable, you will end up developing a permanent damage in your brain, and you have to learn to live with it. It's exactly like me stabbing myself with something in the head, end up with some deficit in my body, and now I want them to fix that. And to give me a pill to fix that problem, the neurologist is going to look at you and says, you're going to go for rehab and learn to walk again, and you have to learn to live with that. So it is a chronic exposure to drugs cause a neurological damage that the brain has to adapt to, but it will not make you go back to where you were before you were at that level. We have 10 people using alcohol for 3 weeks, and then we tell them don't use more alcohol. Probably one of them will continue using alcohol until he learned to be an addict. I like to use that phrase. You learn to be an addict by exposing yourself to the insults from the drugs long enough until you change your brain. When the brain changes, the rule will be relapse, misery, struggling in a chronic way.